Welcome to this webinar on developmental screening in Massachusetts, an alliance between early childhood programs and pediatricians, hosted by UMass Medical School in partnership with the Massachusetts Department of Early Education and Care and the United Way of Massachusetts Bay and Merrimack Valley. My name is Elaine Gabovich. I serve as an instructor at the UMass Medical School Eunice Kennedy Shriver Center. I'm also the state team leader of the Massachusetts Act Early program and the CDC's ambassador to Massachusetts for the National Learn the Signs Act Early campaign. I'm joined by Dr. Rula Shueri, the Division Chief of Developmental Behavioral Pediatrics at UMass Memorial Health Center and UMass Medical School. Whitney Henderson from the Massachusetts Department of Early Education and Care will also be with us during the Q&A part of our program. I'd like to direct you to a few Adobe Connect features before we begin. First, you may download handout files in the File Share box at the top left of your screen. Web links may be found in the box just below it. Today's call is recorded. We hope that you will share this information about this webinar with your colleagues. If you registered for continuing medical education credit, we will post share the post-test and evaluation link at the end of the webinar. You will be required to complete the post-test with a score of 75% or better to earn your CME. If you did not sign up for CME but would like to fill out the evaluation, we'd be happy to receive your feedback as well. Just to share our learning objectives with you, at the end of the webinar, participants should be able to discuss the importance of routine developmental screening as recommended by the American Academy of Pediatrics, describe the validated screening tools approved for use in Massachusetts by MassHealth, explain how free ages and stages questionnaires of the ASQ3 and the ASQ SE developmental screenings are being conducted by early childhood programs, describe the pediatric approach for complementary follow-up screenings through CBHI-approved screening tools, and to list 3 resources that can assist providers in making connections to assistance for families. We will use a 3-part case study called Jackson's Story with supplementary materials, and we will also help you at home think about a poll that we're going to share with you to illustrate these concepts throughout the webinar. The webinar case can be downloaded from the file share box to follow along with the story. It's labeled letter C. Now I'd like to introduce Dr. Rula Shueri, who will start us off sharing the case study, Jackson's Story.
Thank you, Elaine. Jackson is an 18-month-old boy. He comes to your office today with his mother for his routine health maintenance visit. You inquire into Jackson's history and ask his mother how he's doing. She tells you that he can drink from a cup, he likes to walk on his own, and he even uses a crayon to scribble on paper. But she is concerned because he doesn't point to show things and doesn't seem to have gained any new language since you saw him at his last 12-month visit. Jennifer then reaches into her bag and hands you a completed ASQ3 developmental screener.
And at this point, I also want to add that she explains that Jackson's playgroup facilitator at the local XYZ Coordinated Family and Community Engagement Center, otherwise known as a CFCE, introduced the tool to her after participating in several playgroups as a way to monitor his development and educate the family about the importance of tracking milestones in young children. The XYZ CFCE is one of a network of 89 CFCEs in Massachusetts that make developmental surveillance an important part of their practices. Jennifer completed the ASQ3 developmental screening tool with the assistance of the playgroup facilitator, who then recommended that she bring the summary sheet to you, the pediatrician. She lets you know that the facilitator shared some community resources and activities that she can do with Jackson at home as well. So Rula, why don't you take it from here?
So why are developmental surveillance and screening important? So many children with developmental delays are not being identified as early as possible. And in the US only, about 13% of children between the ages of 3 to 17 years have a developmental or behavioral disability, such as autism, intellectual disability, and ADHD. So many younger children have delays in language or other areas, and this will definitely affect their school readiness. However, fewer than half of those are identified before starting school, and by then, significant delays already might have occurred. So this is important really to try to develop screening systems early on to pick up and intervene rapidly. So how does the American Academy of Pediatrics describe developmental surveillance, screening, and evaluation? And there is a nicely detailed recommendation available through the AAP that was published in Pediatrics, and it is available in your handouts as well. And we will go over some of its major recommendations. So what is developmental surveillance? So developmental surveillance is a flexible, longitudinal, continuous process whereby healthcare providers are able to identify children who may have developmental concerns or delays. So there are 5 components to developmental surveillance. The most important one is really eliciting the family's concerns about their child development, and we usually do this by open-ended questions at the child visit. We document and maintain a developmental history, making accurate observations of the child, identifying risk and protective factors, and maintaining an accurate record of documenting the process and findings. So usually it is recommended that the administration of a brief standardized tool will aid in the identification of children at risk of a developmental disorder. And again, it's very important to remember that development is dynamic in nature and surveillance and screening have limits. So this is why there are recommendations to have periodic screening with a validated instrument so that a problem that has not been detected by a surveillance or a single screening can then be detected by subsequent screening. There are also other type of disorders where some regression may occur. So this is why it's very important to really do this periodically. So then what is a developmental evaluation? The diagnostic developmental evaluation aims at identifying then the specific developmental disorder that is affecting the development of the child, thus providing further prognostic information and then allowing, appropriate early intervention. So this may lead to a definitive diagnosis, developing an interdisciplinary comprehensive plan, such as using early intervention, early childhood therapeutic interventions, and will also help to develop a framework of specific skills that need to be monitored, observed, and followed up on. So what does the AAP recommend? What does the AAP recommend as far as testing, material, and when to administer them? And are we discussing developmental screening or autism screening, and what are the different tests and times? So
So,
yes.
so before we go into the detail of that, we'd like to just take a little bit of time for a first poll so that you can informally test your knowledge at home. So think about these choices and see which one you think is correct. So the American Academy of Pediatrics recommends that all children be screened for developmental delays and disabilities during regular well-child doctor visits at at all well-child visits until age 5. Second choice at 6 months, 9 months, 12 months, and 24 months. Third choice is 9 months, 18 months, 24, or 30 months. And the last choice being that developmental surveillance is sufficient. So let's see what the answer to that is. Okay, so excuse me for just a second. There we are. So the answer is 9 months, 18 months, and 24 or 30 months. And so Dr. Schwery, if you'd like to continue.
Mm-hmm.
Oh, great. Oh.
I'm going to go back. Yes. So the AAP does recommend developmental screening at ages 9, 18, and 24 or 30 months. The universal autism screening is recommended at 18 and 24 months. However, if there are no concerns that are elicited prior to 18 months and 24 months or after. And I will show you the algorithm that seems a little complicated, but it is not if we go through it. So this is the pediatric patient at a preventive visit. You have to do surveillance at each visit. And surveillance, it's basically eliciting parents' concerns, open-ended questions. Do you have concerns about your child development? Do you have concerns about how your child is developing his language or her language, walking? And then if you identify risk, then you have to administer a screening tool. And depending on the result of the screening tool, then you either reschedule an early return visit if the screening test is negative. If the screening test is positive, then you have to refer at the same time for a diagnostic evaluation as well as early developmental services. Now, if let's say we go back and you do surveillance, but then there are no risks that are demonstrated by the question that you've already asked, if this is not a a visit that is scheduled within the time that the AP recommends screening, i.e., if this is not a 9, 18, 30-month visit, then you schedule your next routine visit. If it is one of those, then you do have to administer a screening tool, and then it gets you back to if the screening result is positive, then you have to get services referral, and if it is not, then you schedule the next routine visit. It's very important to also think about ASD. And there is another algorithm for ASD, and the times for the universal screening that are 18 and 24 months visit as well.
Okay, so what does Mass Health require for screening in young children locally? So the Children's Behavioral Health Initiative, otherwise known as CBHI, was created by the Executive Office of Health and Human Services to implement the remedy in Rosie D. versus Romney, which was later renamed to Rosie D. versus Patrick. And that was a class action lawsuit that was filed on behalf of Mass Health enrolled children under the age of 21 with serious emotional disturbance. Through the CBHI initiative, Mass Health requires primary care providers to offer standardized behavioral health screenings, well child visits, mental health clinicians to use a standardized behavioral health assessment tool, and provides new or enhanced home and community behavioral health services. As mentioned, Mass Health requires all primary care providers of Mass Health patients from birth to age 21 years to offer a standardized behavioral health screening as part of periodic and medically necessary interperiodic EPSDT, and that's early and periodic screening, diagnosis, and treatment, or PPHSD, which is preventive pediatric healthcare screening and diagnosis screens. These screens require that primary care providers choose a clinically appropriate behavioral health screening tool from a menu of approved standardized tools when conducting a behavioral health screen at each periodic or interperiodic visit. So time for our next poll. Before we get into the specific screening tools, let's just test our knowledge again. And which of the listed screening tools is not approved by Mass Health? Choices would be the Parents' Evaluation of Developmental Status, otherwise known as the PEDS, the Denver Developmental Screening Test 2, the Denver 2, the Survey of Well-Being in Young Children, otherwise known as the SWIC, and the Brief Infant-Toddler Checklist, Infant-Toddler Social and Behavioral and Emotional Assessment, the BITSE. Apologize for that. So the answer, the one tool of that group that is not approved by Mass Health is the Denver 2. And, you know, it's one of the oldest and best known developmental screening tests, but despite being well known, it was never validated, tested for accuracy, and it was standardized only in Colorado. So its length makes it a challenge to use in primary care, and that leads providers to use selected items and that stands to degrade the early detection rates. So we've provided you with handouts and websites that share details about validated screening tools, and pictured here is document letter F that's in the file share box. So it's a brief list of Mass Health approved standardized behavioral health screening tools for children under the age of 21. The age of the patient must be considered in selecting an appropriate tool, and no one tool can be used for all ages. Some tools are free and others must be purchased. So for more detailed information, visit the CBHI website, and we have the link to that in the web links box. You might want to look at that for general information or screening for behavioral health conditions, and also for a list of Mass Health approved screening tools. In addition to the local efforts by CBHI, the federal Birth to Five, Watch Me Thrive campaign, a joint project between the U.S. Department of Health and Human Services and the U.S. Department of Education, is a coordinated effort to encourage developmental and behavioral screening and support for children, families, and the providers who care for them. The campaign has two more resources that can assist pediatricians and other early childhood providers in selecting appropriate developmental screening tools. The first one, Birth to Five, Watch Me Thrive, a primary care provider's guide for developmental behavioral screening, is available in two versions. Handout G1 is the PCP version, and G2 is the Early Childhood Educator version. And there are many other versions as well for a number of professions. These publications provide a further in-depth background on the process of screening for providers. Under letter G3, Birth to Five, Watch Me Thrive, a compendium of screening measures for young children, also provides detailed background information on many developmental and autism screening tools. Due to the risk for developmental, behavioral, or social delays in young children, a community approach is warranted in addition to state and national efforts. Thus, in addition to screening conducted by primary healthcare providers, developmental screening can be done by a number of professionals in healthcare, community, and school settings, serving as a strategic community partners in promoting early healthy childhood development. So the question here is, how is the Massachusetts Department of Early Education and Care responding to the call for improved screening? And so, responding to the call for improved developmental screening in Massachusetts, the Department of Early Education and Care has answered this call by leveraging resources from the National Help Me Grow Center and their Race to the Top Early Learning Challenge grant that builds collaboration across sectors, including child health care, early care and education, and family support. And this important work is steeped in the notion that brain building is in progress for young children in enriching environments with caring adults and meaningful and engaging interactions. Through comprehensive physician and community outreach and centralized information and referral centers, the National Help Me Grow Center, developed in Connecticut, links families with needed programs and services. Help Me Grow aims to connect pediatricians, centralized call centers, early education and care programs, and families to ensure that young children receive the developmental screenings, assessments, and supports that they need to grow and thrive. Similar to the national Help Me Grow model, Massachusetts uses its network of early childhood family and community engagement programs, known as coordinated CFCEs. And these are funded by Early Education and Care. So CFCEs outreach and family engagement work, especially with hard-to-reach families, serves as the foundation of this system. CFCE efforts focus on providing support and education to families and caregivers around child development through the Ages and Stages questionnaire developmental screening tools, as well as connecting families to appropriate services and resources in their communities. In our case example, the XYZ CFCE, along with all CFCEs, uses the ASQ3 or the ASQSE, which is the social emotional version, as a means to have meaningful conversations about early childhood development with families and to engage them in their child's growth and learning. Through a parent-driven approach in line with HIPAA, the XYZ CFCE provider encouraged Jennifer to bring Jackson's ASQ summary results to his well child visit as a communication tool to engage with you about his development overall. In this case, the tool uncovered some concerns that prompted you to continue the screening process in line with his 18-month well visit. In turn, flag concerns from the ASQ were supported by a confirming screening in your office. So let's now look at the next poll, and the question here is, how should a coordinated family and community engagement center, CFCE, approach screening when with a child using the Ages and Stages questionnaire developmental screening tool? And so the choices here are as requested by families, as determined by the CFCE, and as requested by the child's pediatrician. So the answer to that is as requested by families. Families must request using one or both of the ASQs, and typically this is part of a larger educational conversation about tracking milestones as part of learning about healthy development. Families can decide if this is something they would like to do in a trusting relationship with the CFCE facilitator, and in addition to learning about development, the tool can be used to track development as well. So in the next part of our case, we're going to learn a little bit more about Jackson. And so revisiting this, you review the completed ASQ3 and note that some of the concerns that Jennifer shared earlier are highlighted on the routine developmental screening at key well-child visits as recommended by the AAP. But because today is Jackson's 18-month well-child visit, you choose to conduct an autism screening instead using the Modified Checklist for Autism in Toddlers screening tool. And that's the MCHAT, and in this case it's the RF, which is the revised tool with follow-up. And that's a validated tool approved by Mass Health as part of the CBHI. As screening results support concerns of a developmental delay or an autism spectrum disorder, this indicates that there's a need for further evaluation. Dr. Schweritz.
So how should a pediatrician follow up after a developmental screening is positive based on the ASQ3 or the ASQ social emotional screening results? So as we just learned, the CFCEs do provide free developmental screenings using both the ASQ3 and the ASQ-SE when monitoring development. So participation and the tool selection is really parent-driven. And so the PCP may receive one or both of the ASQs from the family. So when the developmental screen is positive and does highlight concerns, the PCP needs to continue investigating those concerns further. Again, this is just a quick overview of the ASQ3, the 18-month questionnaire, and you do see that it covers areas of communication, gross motor skills, fine motor skills, problem solving, and then the personal, social, and depending on the answers of the parents. If the child does express the skills yes, not yet, or sometimes, then there is a total score that is generated. There are also open-ended questions, and depending on the total score, then the screen is highlighting either concerns or not concerns, and the need for further assessment. So how should a pediatrician then follow up with what are the tests that are currently available? So there are several developmental screeners that are available, and the autism screeners available currently are the MCHAT that has been revised and the follow-up interview, and more informations are available on the CBHI website. So this is the MCHAT that is revised, and it is available for free to download at the mchatscreen.com. The currently revised MCHAT does include 20 questions, and it does include yes/no answers. If you remember, the previous version of the MCHAT included 23 questions and had critical items. For this current version, there are no critical items anymore, and the total scoring for concerns relies on the total items that are failed. So, for example, there are specific guidelines, and those are available in your handouts as well with the MCHAT. So there are guidelines for the total items failed, meaning if the families answered that the child does not have the skill yet. So any score 0 to 2 is considered to be low risk, and scores above 7 are considered high risk, and the pediatrician can refer directly the child for early intervention and further evaluation. Scores between 3 and 7 usually require the administration of the follow-up interview to tease out better if the skills are not there yet, meaning that the child really failed the test, or that this was a question that was maybe not well understood by the family.
Okay, so now this is the last part of our case study, and in this you and Jennifer discussed that the ASQ has been an effective way for her to learn about the age-appropriate milestones for Jackson, in addition to highlighting any developmental concerns. You explained that the ASQ-3, in combination with the autism screener you used today, indicates that further evaluation is needed, and you carefully describe what this means. You ask your physician assistant to help Jennifer schedule an evaluation with a developmental specialist and then schedule a follow-up meeting to go over the results in 1 to 2 months. You refer Jackson to early intervention and explain that they can start therapy even without diagnosis. You also schedule him for a hearing test even though his neonatal hearing screen was normal. You want to learn more about the local CFCE because they may serve more children in your practice. You plan on contacting Jackson's CFCE for more information about their programming and resources for families. You realize that you might have some important new partners in the community who may be able to provide information, programming, and support for families that you follow. So,
So what might your next step be to create a follow-up plan now that you have a positive screen? So usually with no concerns. So let's say you were seeing Jackson at his 18 months and there were no concerns. So then the recommendation would be to continue surveillance developmental screening at each child visit, as we saw in the initial algorithm. Now, when there are concerns, as in this situation, so the recommendation is to schedule an appointment in the next 2 months to follow up on the referrals, answer their questions, and discuss any concerns further. And how should the pediatrician share concerning results with the family? Remember, so you've done a screening test, and the screening test is positive. So screening is not diagnostic. So it's very important to highlight the concerns, but at the same time, not to be too alarming for the family.
So this one last poll should help us answer that question. So take a look at the 4 options and think about which one that you think it should be. So the question is, what's the next step that a pediatric provider should take with a family after obtaining concerning screening results for a child? Score the screening tool after the family leaves and call them later with the results. Let the family know that the child has ASD right away if the screening test results are positive. Reassure the family that boys can often develop later, so you will follow up at the 24-month well visit. Or share that the child would benefit from a comprehensive evaluation to clarify any concerns. And so the answer is share that the child would benefit from a comprehensive evaluation to clarify any concerns.
So then important points to consider when giving any feedback. So this is a particular feedback about a positive MChat screen. But again, those are guidelines that the pediatrician and any healthcare provider can use whenever providing feedback regarding difficult news. So it's important to really speak calmly and slowly and provide time for questions. So pause often. Keep the language and medical terms you use simple. And avoid distractions, phone, pager, computer. Really sit down and look at the patient. Usually, we always recommend starting the conversation by using the parent's perspective. So go back to what the parents' concerns were. And if you remember, Jackson's mother, Jennifer, had concerns about nonverbal communication and eye contact. So you could go back to this as the starting point. Emphasize the positive attributes and skills you've observed. So Jackson has been making progress and developing nicely in other areas in his development, as we also saw. You should be clear, but at the same time expressing your concerns and be specific. So describe what you have seen and use the parents' report and the screening test questions to guide this conversation. So in Jackson's case, so his mother had concerns, specific concerns. They were already highlighted by the ASQ3 and then highlighted by the MChat, and you were able to also observe them in the clinic. So then it would be a very good example to use that would really validate the parent's concern. So whenever possible, tie in your concerns, your own concerns with those raised by the parent, such as in this example, and then let the parent know you will follow the child closely and assist in whatever ways you can to ensure that both the child and his family are getting the care and support they need. And this is usually what really parents want to hear as well. So they really want to hear what do they need to do and are they going to come back? And this really reassures families. Reinforce that you hope to be considered the family's partner in this situation.
Okay, so you've learned how the CFCEs are using the ASQs to assist in screening, and how can they and you work together to educate families? Tracking milestones with families of young children is an important way to educate them about what to anticipate in their child's typical development, how to note those milestones that have been met on time, and how to follow up if necessary on milestones that might be delayed. Through regular discussions about a child's development using the ASQ, CFCEs can serve as community partners, promoting and celebrating healthy developmental milestones in young children, and as resources for information and activities that parents and families can use to support their child's development. Every family looks forward to seeing their child's first milestones, a first smile, first step, and first words. Regular screenings with the support of CFCEs help raise awareness of a child's development, making it easier to anticipate milestones as a welcome part of development. These conversations promote universal screening and can pave the way for pediatricians to follow up, continuing to focus on developmental learning for families and heighten surveillance of young children through screening. Just like hearing and vision screenings assure that children can hear and see clearly, developmental and behavioral screenings assure that children are making developmental progress in areas such as language, social, or motor development. The message to families from a variety of providers becomes that screening is just a regular part of growing up. So what types of services do CFCEs use to connect families to child development resources? And how might pediatricians take advantage of these resources in their follow-up activities with families? The local CFCE acts as a community-based information and resource hub for all families in order to increase knowledge of and accessibility to high-quality early education and care programs and services for families with children birth through age 8, including information and resources that address a wide range of transitions. There are 89 CFCEs in Massachusetts, with each program focusing on the specific needs of the communities that they serve. Depending on the community, CFCE programs are affiliated with public schools, Head Start programs, community-based agencies, or center-based early childhood programs. You have a document labeled H in the file share box that gives a brief explanation of CFCE services and activities. Through direct services and referrals, local CFCE programs provide a wide variety of services, such as providing families with access to a number of sources, such as child development information, transition information and supports, assistance with meeting basic needs, timely support in periods of family crisis, high-quality, specific, and up-to-date information and referrals, family literacy and school readiness activities, family and community events, parent leadership opportunities, and information about early education and care opportunities and other community resources that support families in their role as their child's first teacher. CFCE programs facilitate access for the early education and community to consumer education, technical assistance, training, and professional development that support individual competency development, to a locally available set of comprehensive services that support the needs of children and families while promoting program advancement in the Massachusetts Quality Rating and Improvement System, and also referrals for early education and care programs could include, but they're not limited to, physical and dental health resources, early childhood mental health consultation, and occupational or speech therapy. So what are other resources that pediatricians might want to know about? Well, there's the Mass 211 system. That's an easy-to-remember phone number and web database that connects callers to information about critical health and human services available in their community. Mass 211 works with the Department of Early Education and Care to provide support for information and referral services to help families make important child care choices, services for children with special needs, and parenting and family supports. Mass 211 specialists are available 24/7 to assist families and guardians find licensed child care providers. And of note, they also provide links to primary care providers who screen and assess developmental and behavioral concerns in young children. The Brain Building in Progress campaign is a public-private partnership of the Massachusetts Department of Early Education and Care, the United Way of Massachusetts Bay and Merrimack Valley, and a growing community of early education and care providers, academic researchers, business leaders, and others. Their work is based upon the latest science and research on early childhood development. Their mission is to raise awareness of the critical importance of fostering the cognitive, social, and emotional development of young children by emphasizing its future impact on the economic prosperity of everyone in Massachusetts. You can learn more at their website, which is brainbuildinginprogress.org. Please refer to the campaign handout labeled I and J in the file share box to learn more. And then, of course, CFCEs are another referral resource. CFCEs give pediatricians somewhere else to refer families other than early intervention if they have a concern, but they know it's not clinical. So, for example, if they observe that a child needs more social exposure or has a delay but it's not serious enough for early intervention, the CFCEs will host playgroups and many other opportunities that could be of value to that family. Also, the pediatrician could refer a family to the CFCE to do the ASQ if the family comes to the pediatrician first, but then also the pediatrician can tell the family would benefit from a more in-depth learning about milestones that an ASQ might offer. So most of the resources that you've learned about today are listed on letter K, selected references and resources, in the file share box. And today's webinar is one more way that this important campaign for the healthy development of Massachusetts children is reaching out to physicians to join in this effort. And we hope that you've found it to be beneficial to your work with children and families as well. We have one question in the time that we have left, and we're going to hand this off to Whit Henderson from the Department of Early Education and Care. And the question is, where are the CFCEs located?
Hello, my name is Whitney Henderson, and I'm an analyst at the Massachusetts Department of Early Education and Care. And you can find out where CFCEs are located in Massachusetts by going to our website. It's www.mass.gov/EEC. And so that will take you to the Massachusetts Department of Early Education and Care's website. And then if you go to the left side of the page, it'll be in a gray box. There'll be a link that will say Find Early Education and Care Programs. And then once you get onto that page, you will simply scroll down and click on the link that says Find the CFCE program near you. And then there will be on the next page, there will be a drop-down list of all the towns in Massachusetts. You can click Select All if you want to see where all the CFCs are located in Massachusetts, or if you are looking for the CFC for a specific community, you can click on that, and at the bottom of the page, the name, the address, telephone number, email, and the name of the coordinator of that CFC program will be at the bottom of the page.
Okay, so again, I'd like to thank Dr. Rula Shueri from the UMass Medical School in the Department of Developmental Behavioral Pediatrics and Whitney Henderson from Early Education and Care for their contributions to today's webinar. I'd also like to thank the Department of Early Education and Care and the United Way of Massachusetts Bay and Merrimack Valley for their generous support. We hope you found this to be value added for your work and that you'll share the information with your colleagues. Again, this webinar was recorded, and so we hope that you will share it with your colleagues. It is posted at the Massachusetts Act Early website and also at the Shriver Center website. To receive CME, please complete the brief post-test and evaluation by clicking on the link that's provided on this last slide, and you'll be getting direct links to an archived webinar as well through some of your registration materials. We want to thank you for your participation, and we hope that you'll have a great rest of your day. Thank you so much for joining us.